Have you heard about the healthcare reform? Today I'm going to talk about some important advantages that the healthcare reform has brought. Bush's goal nationwide was to have electronic health records implemented by 2014. The New England Journal of Medicine reports a 2000 survey of American Hospital Association. And in the survey, 3,049 people responded, and they responded that 8 to 12% responded that they only have a basic electronic health record system. According to the Handbook of Informatics for Nurses, the Department of Health and Human Services defines electronic health record as a digital collection of the patient's medical conditions, medications, vitals, immunizations, labs, and x-rays. The article of meaningful use of regulation for electronic health records states large incentives can be given for implementation of electronic health records. Medicare will reimburse $44,000 and Medicaid up to $63,750 over 10 years per clinician for reimbursement. To get this reimbursement, you must meet meaningful use criteria, and if you don't have it implemented by 2014, they will be penalized. Reimbursement is a great incentive to have electronic health records, but so are the advantages, which help improve patient care. I get to see these advantages for the patients every day that I work, which I've also seen helps patient care. Patients are going to have more personalized visits. There's going to be decreased redundant questions because the questions and answers are interdepartmental, so each department can see all the questions and the answers. Safety of the patient is also going to be increased because all the information is in one record rather than multiple records. The patient's going to have decreased wait time because the doctor has quicker access to all of their encounters and all the information needed. Patients also will have quicker results reported to them because they are sent directly to their email or smartphone rather than having results mailed to them. The patient can view care instructions, results, request refills, schedule appointments through emailing their physician 24/7. Vault-size medication cards also can be printed off at each and every time the medications are changed for the patient. We're going to have more consistent education, which is going to improve patient learning and allow the patient to ask more educated questions to their physician. Patients are the most important that are affected by this, but nurses are also greatly affected. Nurses have a work list with prompts that are going to alert us when we have treatments or medications due. Therefore, there's going to be decreased errors, improving patient care. Errors are also going to be decreased because the nurses are not going to have to read ineligible handwritten orders from the physicians. We also have computer-generated care plans and instructions, which is going to allow the nurses to use their time more efficiently since they're not handwriting or typing the instructions up. We also have machines that are going to record the vitals and glucose as it's taken. And I have an example here from WellSphere blog. This example shows a glucometer that's going to check the patient's blood glucose, send the results directly to the computer or the physician's smartphone. It will log and analyze it, and we can print out patient information online. This will improve care for the patient, decrease the time that it takes to chart the result, and the doctor is going to find out results more quickly. We also have quick access to all the patient's encounters, which we can then see a patient's baseline. If the patient's lab result is elevated, we can look back at their previous encounters to find their baseline. We also can compare their results more quickly to universal data to find the normal results. With barcode technologies, that's going to decrease time documenting meds. It'll also increase the safety of the patient. You take the barcode, scan the patient, the medication, and that automatically documents when the med is given. This will decrease in errors. Results of labs and x-rays are directly sent to the patient instead of waiting for the information to be delivered to the nurse. Bedside charting also saves the nurse 24.5% of the time. At our facility, we have computer on wheels or a laptop that we bring in directly next to the patient's bedside to chart all of our information. Not only are the nurses affected, but also important advantages are towards the physicians. One tool the physician uses is called decision support. That alerts the doctors with any concerns. For instance, if the doctor orders an antibiotic and the patient has an allergy to that particular antibiotic, this decision support will alert the physician with any contradictions or concerns. Lab results and x-rays are also going to be sent directly to the doctor. He's not going to have to wait for them to be delivered. The physician can also compare trends from the patient's past medical encounters more easily. The doctor is also going to be able to see all the patient's information on one screen rather than flipping through several pages. He's going to be able to see their labs, any pertinent information. This allows for better decisions, decreased time on charting, and the physician is then not waiting for a paper chart to be delivered to him. Also, the physician can view the chart at any time. If he gets called at 2 a.m., he can look up the patient's information at any time from his home computer. This also decreases on lost charts. X-rays and diagnostic images are now part of the chart rather than having to go to radiology and look at the X-rays. They're just right there on the computer. Computerized orders have decreased errors because you don't have to read illegible written orders, and also time spent writing orders is decreased because customized order set. If one order affects many departments, the physician doesn't have to send out several orders for each department. One order is just sent out to all of the departments. The physician can also e-scribe medications, so instead of writing a script, the medication is just automatically e-scribed and sent to the pharmacy. The whole facility has advantages. Auto billing, inventory is going to be easier because all the information is on the computer, which is going to allow for ordering supplies easier as well. Audits are going to be more easy to track, and if you're trying to follow a budget, the trends are going to be more easier to follow. In conclusion, we've came a long way since paper charts, and we must embrace the change. Electronic health records are beneficial for the entire facility, evident by all of the advantages. And advantages have improved patient care. Thank you for listening.